So I'm Jennifer. I'm here to tell my story about my experience in hospital with my husband Dustin. In May of 2012, Dustin got sick and I thought maybe he had the flu or something. And so after a couple of days of him not improving, I thought maybe we needed to see something else, and we called our general practitioner, and she kind of said, well, maybe you should go in and get checked in a Mediclinic or in Emerge or in urgent care. So we went to our nearest community hospital, and things they weren't right, they weren't quite normal. Dustin had some tests, and they recognized that things weren't the way they should be. And all day we could see that things were getting much worse. Dustin was really struggling to breathe. So around 4 o'clock in the morning, Dustin was admitted into the medicine program at the Royal Alexandra Hospital. And I kind of thought, okay, he's here, we're at a big hospital, things should go as planned. And so I slipped out to go home and have a shower. It by then had been 24 hours since I'd been up and away from my family, my kids. Around 10 o'clock the next morning, I looked at my cell phone, and there were a lot of calls from the hospital on my cell phone, which is always makes you panic a bit, because if they called that many times, things aren't obviously good. So I returned the calls, and they said to me that Dustin was quite sick and that they were looking at taking him to intensive care, and that they would try to hold him on the unit until I got there, but they weren't positive that would be something that they'd be able to do. The doctors, I remember them giving us time. They're like, well, do you have any family you'd like to bring in with you? We're gonna, intubate him and kind of put him under for a bit. Do you have anybody who wants to kind of say anything to him before we do that? And I really felt like, oh my God, like, this is it. They're asking us to say our goodbyes. So I think it was late that first night in ICU, the doctor came to me and he said, I think I know what your husband has. And I wish I could tell you it was something else. I wish I could tell you he has cancer or something else, but I think I know what he has. It's a disease called hemophagocytic lymphohistiocytosis. I went, huh? And he said, well, let's just call it HLH. And I said, well, can you write it down for me? Because later I'm going to want to know what the real word is. I had asked Dustin one time, like, who were the best people? Like, who were the people that made the difference? And I was kind of surprised by his answer. So he had said that Cindy was probably the best person that he'd ever met in all of his 6 months and all of the other months that he had stayed. And I said, really? Like, she was the healthcare aide. Why was she the best? And Dustin just said, well, every day Cindy just came down, she sat down and she said, what do you got planned today, Dustin? And nobody else asked him what he had planned. They would tell him, we have this planned and this planned and this planned, but nobody ever asked him. And I think that was the part that he struggled with most, is that he felt he was lost his identity. So people often ask me now, 3 years later, how has this changed me and changed us? And for me personally, it's changed probably the most how I work. I'm a clinical nurse educator in the Edmonton area, and it's changed how I look at everything. Part of my job is to do orientation and education, to look at policies, to look at forms and things like that. And now I can't stop myself from looking at it a different way. And I feel like for the first little bit, I thought maybe I needed to change how the patient interaction happens. But now I recognize that I have such a huge opportunity in my educator role to change it on a much bigger level. So, one of the things that I was really looking for is when we talk about orientation, like, where are we talking about how we make a difference to the patients and how those little things matter, and how do we put that story and that emotion into that, and why we do it, and re-energize our staff in orientation. When I look at forms, I always look at, is there a section here about where we've shared this information with families or with patients? Have we included them in there? Is there a place for them to say, yes, I've been involved in this conversation?